Hi, everyone. For those of you who have watched some of my videos, you know me. I'm Dr. Seth, psychologist. Today, this is the first video in a new series that I'm doing called Why People Stay in Dysfunction. Why People Stay in Dysfunction. And the reality is that many different people are dysfunctional and stay in dysfunction in their lives in some way or other for different reasons. Now, people can be dysfunctional in different ways. And the thing is, the problem really starts when a person stays in dysfunction after a long period of time. They stay, they don't change. Why don't they change? I'll talk about that in a minute. But here's the thing: people stay in dysfunction for what I would call, really, and this is kind of blunt, a mess, an emotional mess of reasons. And the reason that I say an emotional mess is because a lot of times when a person has gotten to the point where they're staying in dysfunction, so often they are not actually even aware of all of the different feelings that are going into the mix of why they stay. People, surprisingly, can be really out of touch with some of their own feelings, especially when their lives become dysfunctional in some ways. People often are also unaware of some of the beliefs that they have, some of the false, maybe negative beliefs they have that are keeping them locked in dysfunction. But one of the most important points of all that I want to make in this series that I'll be doing, and this is really the intro video, is that so often once somebody is staying in dysfunction, a lot of times they are not really honest with themselves about why they stay. What happens is that sometimes after a person's life becomes so dysfunctional in some ways, the ego and pride kick in. And people really work hard to try to tell themselves that the reason that they stay in dysfunctional situations is often for reasons that actually make them feel good about themselves, or for reasons that allow them to blame other people. They say they stay because of other people. And yet, the truth is, it is an uncovering process that is required for a person to understand, to come to grips with what is actually often an emotional mess of reasons, and to clean it up, to organize that situation, to get to a point of understanding where a person can say, I am staying in dysfunction. It's true. The main feelings that I have about my dysfunctional situation are, and then they may list any number of feelings: anger, resentment, maybe sadness, maybe fear. There are often many different types of fears a person can have when they stay in dysfunction. And a lot of times I find clinically that people are often not aware of some of the very things that they are afraid of, some of the true fears that keep them staying in dysfunction. Above all, the point is to get organized about some of the beliefs, some of the negative and false beliefs that a person may hold on to that keep them in dysfunction. Feelings and emotions inherently are messy. There's not a natural science to it. What does depression look like on a molecular level? It's kind of difficult to say. The thing is, we feel a lot of these feelings, and sometimes they're even hard to describe. They're certainly a lot of times hard to figure out. I think a lot of times feelings actually can feel confusing. The whole mix of feelings can be confusing and really hard to understand. I hope that my video series on why people stay in dysfunction will help to give you maybe a little bit better understanding of your own thoughts and feelings in the mix of why you may stay in dysfunction. but one thing I want to share is a visual, an actual picture. When I talk about how people often stay in dysfunction because of what is often an emotional mess of reasons, I want you to picture something, and it might help elucidate a little bit better what I'm talking about here, why a person actually comes to stay in dysfunction. So, picture, for example, the most neatly organized garage you can imagine. Let's imagine there are two cars in it. The cars are perfectly washed, just washed this morning. Maybe on one side of the garage, there's a workbench with all the tools neatly organized. The floor of that garage is clean. It looks like maybe it was hosed down a week ago. On the other side of the garage, maybe there are some hooks and some things in the garage hanging on the hooks in very organized ways. Maybe there are a couple of bikes, there are a couple of hoses, all the things that you might picture in a garage, but it's neat and organized and tidy. Now, I want you to picture a very different kind of garage, a garage that is so messy that when you open the garage door to the garage, you realize cars can no longer even park inside it. That's how messy it is. There are things everywhere. There are things that make it difficult to even figure out what's where in that garage. And here's the thing, if somebody were to ask you, you know what, I need you to clean the garage, do you know what most people would say? The first thing that they would think to themselves when they open that garage and they know that it's their job to clean it, most people would say, I don't even know where to start. I don't even know where to start. That's how overwhelming that situation can be for somebody. And it is in a very similar way that a person comes to stay in dysfunction. Why a person often stays in dysfunction? Because after so many days have turned into weeks, and then the weeks have turned into months and often years of some type of dysfunctional lifestyle that a person falls into, it can be difficult to say, well, you know what? Tomorrow is the day I'll change, I'll improve things, and then actually follow through with it. In a way, the dysfunction becomes, sadly, the new normal. The new normal. And that can be problematic because when people stay in dysfunction, I believe they often suffer in many different ways. They may be more prone to feeling anxiety or like life is chaotic or out of control. They may be more inclined to feel depressed. They may be more likely to self medicate in really unhealthy ways. And so ultimately, as I close this intro video for my new series, what are some ways that people can stay in dysfunction? Well, an individual may stay in dysfunction in a romantic relationship. An individual may stay in dysfunction in a family dynamic they have. An individual may stay in dysfunction with some type of friendship that has ended up being really unhealthy and frustrating for them. An individual may stay in dysfunction in a work situation. An individual may stay in dysfunction in terms of alcohol or substance use. An individual may stay in dysfunction in terms of some sort of unhealthy acting out behavior, getting stuck in a pattern of poor anger management, or trying to over control everyone around them. There are many different ways that a person can stay in dysfunctional dynamics. And there is hope. This type of behavior can be changed. It's going to take some work, and I'm hoping that my video series can be helpful. I also want to note that I have many different types of videos on my channel here. And if you check out the playlists, you can see the different playlists organized around mental health topics that hopefully can be helpful to you in some way to help start improve your life. I'm Dr. Seth, psychologist.